The key bioethical situation that we are going to discuss today is a conflict in the application of patients' autonomy between developed and developing countries in the field of dental health. Introduction. Ethics is a very important issue in the medical field. Ethics makes a distinction between what is right and what is wrong when there is a very high level of uncertainty. Coming to our bioethical situation, let us see what happens in developed countries. A patient with toothache comes to the dental clinic for treatment. Dentist goes for proper diagnosis and advises patient regarding the various treatment options. The dentist undergoes all the diagnostic criteria and explains the treatment options. He advises extraction of two teeth in two ways, both extractions at the same time or else extractions done at subsequent appointments. The dentist takes the informed consent from the patient and performs the treatment according to the wishes of patient. The necessary treatment is performed with both dentist and patient satisfied. Now let us see what happens in developing countries. Patient comes with similar symptoms and the dentist performs examination. Without explaining various options regarding the treatment, the dentist decides extraction as the best procedure. Dentist performs the treatment. The extraction is done in the patient in the same appointment who hardly has any knowledge of the various procedures and their outcomes. Dentist seems to be fairly satisfied and the patient walks bewildered with a lot of questions in his mind. Now, is there any difference between the two scenarios? Yes, definitely. The first scenario saw the involvement of both dentist and patient, whereas in the second case, we saw the dentist being the one taking decision on behalf of the ignorant patient. Why isn't the patient described the various treatment options and then allowed to take decision in a more balanced way? Henceforth, this case definitely sheds light on the ethical concerns of the patient. What do we learn from the actual scenario explained above? It definitely brings into light the breach of autonomy of the patient and the poor exercise of the informed consent. What is autonomy? Autonomy is an individual's capacity for self-determination or self-governance. So, what does American Dental Association explains about autonomy? Under this principle, the dentist's primary obligations include involving patients in treatment decisions in a meaningful way with due consideration being given to the patient's needs, desires, and abilities, and safeguarding the patient's privacy. The dentist should inform the patient of the proposed treatment and any reasonable alternatives in a manner that allows the patient to become involved in the treatment decisions.
In Ozar and Sopol's model of the patient-dentist relationship, the dentist and the patient are equal partners in the decision-making process. This relationship is defined by three areas. They deserve each other's respect, each has a set of values, and each comes to the decision-making process about the patient's oral health with the understanding that information must be shared. Thus, it is essential that the dentist and patient communicate and cooperate effectively. Furthermore, it is said by Reed, the dentist's role in describing findings and recommendations is the part of the process of obtained informed consent. When dental professionals are trained, the subject of consent is usually taught as a part of jurisprudence or ethics course. It is often the legal aspects of the consent that dominate discussions. The result is that, over many years, the process of obtaining consent from individuals is often more concerned with getting a signature on the form and protecting an individual or an institution than anything else. So how to encourage autonomy? Firstly, Patients should be able to make decisions for themselves, free from controlling interference and influences. This means that a dental professional should approach a discussion about a diagnosis by first educating the patients about the problem and articulating the recommended treatment plan. Following the principle of respect for patients' autonomy, the dentist should then encourage the patient to consider this information carefully and offer to answer questions, with the ultimate goal of actively assisting the patient in making an informed healthcare decision. In addition to it, it is important for the clinician to graciously accept the possibility that the decision may not include acceptance of the proposed diagnosis or treatment. Any attempt to unduly influence a patient erodes the professional boundary between dentist and patients. The process of obtaining informed consent does not consist simply of a presentation of information. It should reflect the dentist's effort to educate and discuss the findings with the patient, and out of respect for patient's autonomy, he or she then should encourage the patient to make oral healthcare decisions without salesmanship, urging or persuasion by the dentist or dental staff members. As members of a respected profession, dentists should inform patients routinely about the range of treatments available in the dental community, acknowledging the various methods of diagnosis and treatment and underscoring their own professional approach without pejorative reference to other people or treatment. As Beauchamp and Charles pointed out, from the moral viewpoint, informed consent has less to do with the liability of professionals as agents of disclosure and more to do with the autonomous choices of patients. Coming to critical analysis, dental decision making involves both dental and personal decisions, and dentists are not justified in substituting their dental judgments for their patients' informed personal decisions. As MacLean puts it, while it is accepted that the physician is the more competent to make the clinical appropriate decision, the patients remain the person who alone can take account of this clinical recommendation, evaluate it, and ultimately make a satisfactory personal decision. However, O'Neill believes that it has now become too individualistic. She reminds us that John Stuart Mill hardly ever uses the word autonomy, and when he does so, refers to states rather than individuals.
In the opinion of Schneider, the overwhelming weight of bioethical opinion endorses not just the autonomy principle but a potent version of it. He considered that this paradigm is sustained by the assumption that autonomy is what people primarily and pervasively want and need. Thus, the dominant view of individualistic autonomy in most recent liberal bioethics is that it confers a right to act on one's own judgment about matters affecting one's life without interference by others. O'Neill considers that conceptions of individual autonomy cannot provide a sufficient and convincing starting point for bioethics or even for.
Schneider suggests that there are two current models of autonomy, optional and mandatory. Brock defines the former as entitling but not requiring a patient to take an active role in decision making regarding the treatment. In the latter model, it is practically unwise and morally objectionable for the patient to forswear making medical decisions personally. Although this latter model seems to eliminate any residue of medical paternalism, is it not in danger of replacing it with an equally unacceptable paternalism by ethicists? Recommendations. Building upon O'Neill's theory, we recommend that a revision of operational definition of patient autonomy is required for the 21st century. We have been influenced by the following ideas. Autonomy involving ethics as the activity of persons bound together in a common pursuit. Patient autonomy as the capacity to assess critically one's basic desires and values, and to act on those that one endorses on reflection, and also those actions and decisions that tend to promote the settled goals of the individual. In this model, a patient is fully entitled but not required to take any active role in decision making regarding treatment. Question that arises: is it necessary to take patient's consent in every clinical situation? Are the doctors or dentists not competent enough to take decisions for the patient's welfare?